Welcome to the Think for Yourself Clubhouse. I am Bill Martin and my co-host is Dennis Reinhardt. Today we are interviewing Mike Evans and Tammy Osborne-Smith about social services in Jackson County. Is it okay if I call you Mike and Tammy?
Absolutely.
100%.
Okay. Tammy Osborne-Smith is currently the director of the Jackson County Job and Family Services Agency. She holds a degree in business from Ohio University and has worked in the field of social services for about 20 years. She now runs the place down there. Mike Evans, during his active career, was a top-level business executive. He holds a Master of Business Administration degree from the University of Toledo. He was a longtime manager of the Bellisio Foods plant in Jackson. He has been intimately familiar with the problems of running a food plant in southeast Ohio. What I thought we would do today is to sketch what each of you have done in your careers, then try to figure out why you're sitting at the same table. Mike, how long have you been involved with the food plant in Jackson, now called Bellisio Foods?
32 years.
That's a while. What products does the plant make?
A lot. There's two product formats. There's the branded side of the business, which they manufacture products under the Michelinas brand, which is the cardboard box, for lack of better words, that you eat out of, and Boston Market, Atkins, Quest, and Authentic Asia. And then the plant also co-packs for different co-man Parker, different manufacturers as well.
What are the quantities involved?
So look at it kind of like this. The facility is 17 acres under roof. They receive, let's call it 350 tons of groceries a day. They convert that into 1.5 million meals and ship 350,000.
Are you getting this, viewers? This is a bunch of food that runs out through that plant.
There's a lot of food.
A lot of food. And we see truck traffic in and out of the plant. Where does the Bellisio ship to?
Ships to every major retail warehouse in the country and Canada and overseas. We export product, well, not only to Canada, but also some to Japan and Latin America and South America.
Wonderful. What's that structure that was just built? Looks like the big cube.
That is a frozen warehouse. It's a fully automated warehouse. It's called an ASRS, an Automatic Retrieval and Storage System. It has nobody working in it, all right? It'll hold up to 10,000 pallets, regular 40 by 48 pallets. And it'll take an order, just like a human going to pick a product for a truck would take an order, and pulls it out of this thing and sets the truck up for the employees to load the truck. So it added and augmented to the distribution channel for Bellisio. So we're known best for the manufacturing, but there's also a large distribution center that services the entire country again and Canada. So that ASRS enhanced those capabilities to not only store more product, but to make it more of a consolidating center.
Would that be frozen food then?
Frozen food, all frozen.
So that would be one big ass freezer then?
It is one big ass freezer. Yeah.
Okay.
Yep.
How many employees are in that plant?
Right now there are, I want to say 800, right at 800 employees.
800? Mm-hmm. Is the workforce fairly stable?
Yes, once they're past, there's a probationary period, and the food business isn't for everybody. But the most churn that happens is within their 90-day probationary period, and past that, the stability and the tenure starts to get better. Right.
Good.
Did you have an adequate number of workers?
We do.
There's no shortage of.
Well, keep in mind that's a good question. So, and there's not a direct answer for that. So,
Okay.
When CP purchased, we're totally owned by CP Foods, a Thai company, and when they purchased that building and that manufacturing facility, they had two things in mind. One, to automate it. It used to be very, very manual, especially in the packaging areas, and second was to change the business model a bit, not to be so reliant on one brand, and that was Michelinas. Okay, so they expanded their portfolio to Asian products and what have you. So, but in that process, there were 200 jobs that were repurposed. Okay, the peak employment level at that plant was 1,400 people. Okay, and that was in right before the pandemic. All right. And so once that we got past the pandemic, they started to change. CP started to adjust the business model and basically retool the plant. So the last 2 years, they've been retooling the plant to produce more better breaded proteins, some more co-man products, and more Asian type food. Notwithstanding, they're keeping the Michelinas and Boston Market brands alive, but change the business model. So during that, the employment has come down. But we have seen during the pandemic, everyone is having trouble getting employees. But post-pandemic, we've been able to rely on the local workforce, okay, to an extent. So most recently, there's been some folks, because they've hired back, they're starting up some of the retool lines again, and the companies had to go to what they call a TN visa program, where they bring employees in from mostly Canada and Mexico, all degreed folks, and I think there's 10 or 12 of those folks. So we haven't been able to fill that void locally.
What's the starting pay for a plant worker?
It is $15.80 an hour.
Okay.
And
how many hours a week? Is that full time?
Yep, full time, 40 hours. 40 hours.
And the typical wage for experienced workers, the fellows that you said, you're able to keep?
Yeah, the average wage, which is probably more reflective of the workforce, is almost $19 an hour.
Okay. And what health care coverage does a Bellisio employee get?
So that's another really good question. The Bellisios and CP, goes all the way back to Geno's, has always had a propensity to really take care of workers and pass on the fruits of our labor in way of benefits. So they have full medical and dental eyewear coverage. Back in 2018, we put a health center in, okay, that's free of charge for employees that work there.
Is that the clinic-looking building that you drive by on Broadway Street?
Yes.
Okay.
Yes, across the street. If someone has a prescription to fill, they can get it filled there if they have it on hand for nothing. And they just expanded that to the families of the employees of Bellisio Food, that availability, as long as you have their health care coverage.
Not bad. Okay, let's shift over to Tammy for some introductory remarks. Tammy, I noticed a broad range of social services when I Googled the Jackson County Job and Family Services. Let's give a thumbnail sketch of some of those services, if we may. One category, big category, would be Medicaid, food, and cash assistance.
Sure. We are actually a quadruple combined organization, which means we do have the public assistance, child support, workforce development, and we also have the division of, I'm sorry, you have me on camera, I'm going to do that. We have our administration office will be our other area, and then you mentioned the Medicaid. Our Medicaid food assistance and cash assistance individuals make up quite a large team in our organization. They're almost the largest team, only outnumbered by Children's Services now. And within that department, they do both the determinations and redeterminations of Medicaid eligibility, SNAP eligibility, and of course our child support team.
SNAP is food stamps?
Absolutely, yes, because that's the new term everybody may not be familiar with. The SNAP is the food assistance program under the USDA.
And that's important these days because, as I understand it, we're feeling more and more pressure in rural southeastern Ohio with respect to food insecurity.
Absolutely. And one of the things we noticed after the pandemic, individuals are receiving a larger amount of food assistance and now returning to, and then pending whatever is about to happen with our federal budget, the possibility of some shifts in that plan. So families are already looking at, again, the S is for supplemental. It's not that it's enough exactly for a monthly food budget, but it's to supplement that food budget.
Sure.
So one of the strains we also see once there's a strain on the SNAP system is that then our food pantries are highly looked to also fill that gap. Yeah. Talk louder. Keep talking. And then unfortunately, with the budgetary changes that are potentially going to happen with, one of the things we see is that, a lot of the costs are going to start beginning to shift to the states. You know, the SNAP program has been a long time federal program, and what they're looking to is to start looking at whether states have error rates, and we have a lot of things already in place to prevent fraud, to prevent abuse. But they're looking at automatically shifting a portion of that cost to the state of Ohio. And
They're already making cuts
Yes.
to a lot of things.
and that's going to shift about
our state
minimum of
legislature is
$60
not-
million over to us,
Right.
let alone the additional things that they're already conversing about that possibly could happen. And you know, we know what happens when costs get shifted over to the state. Well, then they look to transition it down to the local level, and we absolutely just don't have the local funds
No.
to support that.
No.
Yeah, we got to learn from Representative Russo, Minority Leader Russo, that the state legislature doesn't appear to be an overly generous body with respect to these kinds of issues.
And it's
When I was in the divorce biz, child support was a biggie.
Yes.
How much child support is paid? How do you keep track of child support? What do you do if somebody doesn't pay child support? And that's part of what you guys do in your agency, is it not?
We do.
Keeping track of all that?
We do.
They, years and years ago, took it away from the court system and put it in the Jobs and Family Services structure. Adult Protective Services, again, we've talked about that some at this table. There are on occasions, again, when you're in the legal business, that you come across these tragic cases
Sure.
where folks may be stuck out in a temporary structure in the boonies, no sewer system to speak of, very little water, hot, no air conditioning, and they're stuck out there. And every once in a while, the workers have to go out there and say, this is an intolerable situation, we have to do something. Take that individual out of there, and maybe diabetic, maybe Alzheimer's, and get that person some help. And that would come under the rubric of Adult Protective Services.
That would be Adult Protective Services, those 60 and over. And what we do see more often than not nowadays, you know, it used to be self-neglect was one of our number one reasons, and now we're seeing exploitation, and it could possibly be exploitation financially, or it could be exploitation on other levels of folks trying to take advantage of the assets that person may have.
Is
or
that family members doing that?
accessing? It can be family members or someone that's might have been considered family. Maybe it's a long time neighbor or a friend of the family, and those individuals are sometimes coming in and possibly drug seeking. Maybe they're struggling with recovery. I definitely don't want to go down that,
Yeah, another division you've got in your agency is something that I have had some experience with in my career, and that is Child Protective Services. I was a county assistant prosecutor for a while, and I well remember the child protection workers coming to my office with a fresh case, sweaty, they just got thrown up on. It's just a mess, and they come in and they report those cases and they prosecute those cases to take care of the kids. And after that, of course, we had more problems with drugs to the extent that there was a lot of child protective business going on. Also, tied up with that is you folks handle foster care and adoption, do you not?
We do, and that unit that works along with the protective services, you know, one of the things we've seen over especially the course of the last 5 years, is the level of trauma that children are experiencing. You know, we see kids that are not only from a home that might have been struggling with poverty, which is absolutely not a reason to ever remove a child. You know, we want to help those families with resources, but what we're seeing, maybe multiple family members or multiple generations within a family struggling maybe with their financial situation as a result of not being able to stay in recovery. So we can step in, help stabilize that family, help give them the resources that they need, and it's not always possible. So at the other end of that spectrum, we've seen a record number of kids come into permanent custody into the agency.
Are there adequate services that are mental health services that we have, or is there a shortage?
There's absolutely a shortage. And we are not only in a placement crisis, but we're in a service crisis for supports. We have youth, more than 60% of our youth in foster care placed outside of Jackson County. So we have kids in Toledo and Youngstown, you know, all the way down to the river. And it's not been unusual for us to place a child in a care facility that's outside of the state of Ohio. In order to obtain again, we're talking about multiple diagnoses and multiple needs for these kids, and we just aren't simply equipped here. Just to
Is there a
keep that service
danger
here.
of even that being cut with the cuts that are being made in mental health services?
Mental health services may be impacted. One of the things we're waiting to see is the end result. And of course, when you have a workforce crisis, as Mike touched on a moment ago, we've had that workforce crisis for a very long time in the service industry. We've seen record numbers of individuals actually leave the area of child welfare. And that's something that we've not been immune to here in Jackson County. For a couple years, we had gone and had a full staff, but we experienced a loss of those. And for every time that a child has a different caseworker, it adds to the amount of time that they stay in foster care. So it's so important for us to be able to stabilize our workforce and make sure that kids can have quality care with their team. And I'm not gonna. I see already. I'm not looking at. I'm not looking at the camera.
Is it difficult to find foster parents? I've always heard that that's really a big problem, to find people that volunteer to do that.
It is, and we are working through a partnership with Athens, Perry, and Meigs and Gallia County to actually obtain additional treatment foster level care, because just an entry level foster home may not be what the kids need anymore. They need someone with that additional training and skills to help address the level of trauma that they're seeing and experiencing.
Okay, with that introduction from both of you, let's kind of move on to the topic, which I found so interesting and Mike suggested several weeks ago. Mike, let's introduce our topic by asking whether you have ever had occasion to hire Haitian immigrants to work at the Bellisio plant.
We did during COVID.
Why did you do that?
Well, there were, obviously people were sick, right? And the workforce, the ebb and flow of the workforce wasn't consistent. We had anywhere from 100 to 200 employees calling in each day because they weren't feeling well or they had COVID. And we did okay supporting that by putting on a 6-day, a Saturday production, all right? And even an occasional Sunday. And, we had hopes, and several times we actually took the masks off. But when the Delta variant hit, it was very severe, and people just weren't coming back to work. And we
Have you had problems getting employees from time to time?
Yes, yeah, and the local workforce couldn't support that fill of employees needed for that situation.
Okay.
So at that time, we partnered with a firm in Dayton and they hired Haitians, okay, because they were under amnesty and they were going to stay, and with the thought they could stay here in Jackson County. So we were employing up to 180 of those folks at one time, and now there's, I think, a handful that stay. Most
Very hard workers.
Yeah, good workers, good hard workers. Yeah, yes.
So I suppose we've had discussions about you would really kind of prefer to have local folks,
Of course.
if you can, and there are some impediments that you've experienced towards about getting local folks to work steadily in the plant. And one of the impediments that you talked about, you spoke to me about, was, well, they don't have transportation to get to work. Has that been your experience, Mike?
That has. So we like other employers, we draw from like a 6-county area around here. Ross, Pike, Scioto, Gallia, Benton, and Athens to an extent. So, but the majority of the workforce is from Jackson County. Probably 60% of the workforce from Jackson County. So the transportation becomes difficult for some of these folks, particularly some of them that fall under Tammy's purview. Maybe they don't have a reliable car, or they don't have one, period, or they simply can't get out of the back roads and the hoops and hollers, if you will, to get to work. So as you know, we took a stab at a transportation system ourselves at Bellisio, and just the ebb and flow of the workforce, the start times and stop times weren't consistent enough to make it work, given all the areas that we had to pick up and drop off. You almost needed probably a dozen vans going out to almost 24 hours a day to make it work. So we had to ban it. We partnered with the YMCA at that time. We invested in the equipment, we invested in the maintenance, the drivers, everything, right? But just couldn't make it work logistically. And so people, we were sending empty vans or one or two folks, which are important. They're real employees, and it's important they get to work, but it just didn't work for us.
Would public transportation be more effective than what you were trying to do?
Let's get Tammy's opinion here,
Yeah.
because I think she's got some experience in it.
I think yes.
Yeah.
We absolutely think so. I've been in the field of health and human services for over 30 years now, whether either at the state or local level. And the one thing we always hear from employers is that we don't have enough reliable transportation, especially here in Appalachia. So one of the things that we wanted to do is, finally put a solution to that. And we have been working over the course of the last 7 months with a firm and working on a transportation development plan, also with a group of an intersecting group of business leaders and professional social service organizations here in Jackson, thinking about what do we even want this to look like? How can we serve those people? How can we get people to Bellisio Foods? How can we get people to their appointments? What if you're not eligible for Medicaid? Because we do almost $1 million worth of transportation services per year for Medicaid clients. But what about the rest of the population, those that are on the borderline of being eligible for that? Or just simply a lot of families can't afford that second car for another person to go to work by the time you pay a car payment and insurance. Getting those individuals in the door. So the work we have been doing is building toward actually putting a public transit system here in Jackson County, one that's not only going to provide an on-demand service, but one that can provide a fixed route service. And our initial plans, although we're very, very early, show us drafting a route that goes through Jackson, right by Bellisio Foods, right past General Mills, and swinging back to Jackson, and every hour having that as our fixed route and being able to help a lot of people get to work.
Did you say every hour?
Every hour.
Oh, wow.
That's our big goal. Of course, in the first 6 months, we're going to be piloting some of this. Maybe we don't need it every hour. Maybe it's better every 2 hours. But taking a look at what's really going to be meaningful and impactful, and not just for those job seekers. We know, public transit can also serve a population of kids after school. Maybe mom and dad can't always pick you up from practice that night, but they can get you to grandma's house. Maybe the transit can come by and pick you up. And we can start creating solutions beyond that, and then finally get into our tourism. And hopefully, eventually, maybe you can jump on the bus and go out to Lake Catherine or take a hike in the afternoon. But it's going to be a very long process. We ask the community to please be patient with us, but we have already applied for 5 vehicles through the Ohio Department of Transportation, and hoping those are going to be awarded to us. Fingers crossed, we should find out in the next 3 or 4 weeks.
I was going to ask some questions about that. I guess probably the most important was, where does the money come from?
Well, the money comes from a variety of places, and with us already working through the partnership of the NET, the non-emergency transportation related to Medicaid, we will be able to use some of that as our local support as fares. Also through partnerships in our community. I have a colleague county up still in Appalachia, and they currently have 32 contracts in their community. They serve a variety of businesses, they serve a variety of organizations. So you get about 50% of that funding from the federal government for a vehicle, about 20% from the state. But when you start looking at the operating costs, that's going to require about 30% local funds from here in Jackson County. And making sure that folks know that this is not a Jackson County Job and Family Services project. This is a Jackson County project. We want everybody to feel proud that we're going to be able to bring this here and serve everyone.
How much will it cost the rider, the bus rider?
Potentially, the rider could pay between $3 and $6 for their fare, depending on where they're going. So again, very preliminary, but we're working out some of those details.
So they get at the bus stop somewhere in Jackson County,
Sure, we're planning on
and then
34
the
bus
bus ends up
stops.
at Bellisio and in time to go to work.
Well, that's the hope. If they start, we have something potentially on Main Street, and then within 3/4 of a mile, we can pick somebody up too of that route, of that set route.
And you're taking into account all the fuel costs and maintenance costs and all that, because that stuff is expensive.
Just with those 5 vehicles starting out, we're looking at a cost of about $1.1 million a year is what we're looking at. And that's before we get geared all the way up. And year 2 is when we hope to be able to provide that full service. You know, of course, with on-demand services, folks will be able to call and say, hey, can you pick me up a couple days in advance? We'll make those arrangements. But once we get to the fixed route, you know, with the potential of 30-some bus stops, I mean, our community is going to look different and it's going to feel very different.
And we're one of how many counties that does not have?
Yes, there's only about 11 counties in Ohio that do not have public transit. So it's time that, we don't want to be last.
What are some of the counties around us that do have public transit?
We have Meigs.
Rural transit.
Yes. If you want to look up, Lieutenant Governor Jim Tressel just visited Meigs County. They just opened their new facility there. They've been doing this for a couple years. Gallia County is just slightly behind us ahead of us rather, about 6 months. And then, other counties, Pike has been in the business a long time, of course, with Ross. They are very well established, and we hope to eventually build a partnership with all of these folks that we can get somebody to that county line. If we can't get them to their appointment, get them to the county line so they can get. There was a very high level of interest in us having a regional transit route to Chillicothe because it's one of the number one areas that we actually travel to, other than Gallipolis.
Well, what can the viewers do to gin up support and let for example, commissioners know that this is something they would like to see?
Sure. I think whether it's a letter or if they wanted the organizations that they're part of, let them know. Thinking there will be opportunities to adopt a stop. We are going to encourage businesses and partnerships throughout our community to adopt a bus stop and help us with that. That's going to be a very minimal cost, but imagine, the business will be able to display their business name there.
Have you approached the commissioners about any of this?
We've met with commissioners and talked to them about transit for quite some time, and actually brought in the vendor that we've been working with in the Ohio Department of Transportation.
How did they seem? Did they seem receptive of it?
They are. I think they're excited about the same things, eliminating that barrier that's always been there for the employers, thinking about where can we go next.
Have you met with Mayor Feeney in Chillicothe?
I have not, but
They got a really good program with their trolley system that goes to the parks and all that. The trolley cars were donated by the companies that use them in the big cities. Then all they have to do is pay for, of course, the maintenance and the transportation. And then what they did is they opted to get a grant system to get up and started and going, and they got a $750,000 grant, and it was matched by the partners of the businesses in Ross County. So he would be really helpful to you. Because they have a fabulous system now, and that trolley system it goes up to Adena. If we can get the park system going, you could go hit Hammertown on that with the trolley, and then you'd still have your other busing system.
When we were talking about it, we talked about, in Pigeon Forge, when you get on the little tram, is that going to be, and I keep looking at this name called Iron Valley. People have to know the history of Jackson to know if we nickname something, whether it's a Apple Valley or Iron Valley or something, to give a little flash to our history here in
They
Jackson.
used to have a belt railway
that
in
mural
Jackson
there.
County.
Yeah.
That's the mural for it.
They ran between
Oh, yeah.
Wellston and Jackson around
On the short rail.
1900. It was called the Belt Line, electric powered car.
Maybe we need to think about that.
What's the name of that road in Wellston, Aggie? Electric Park Road?
Yeah.
And they had a park in Wellston that was at Lake Alma, I think.
That was the
That was an
Wellston
amusement park.
Jackson belt line, right?
Yeah, I think it, yeah.
Yeah.
Electric.
Also, of course, if you have a project like this, you're going to have employees. So
We-
it's going to be a small business right there.
It will be, and the hope is eventually, this will become a department of its own. Right now, initially, it will be housed under Job and Family Services. We already have the experience of working with state and federal grants, and have the ability to start with those Medicaid net trips that we already are doing. We certainly don't want to interrupt services that are existing, but we want to use that experience that we have as knowledge on how do we take next steps.
I think that's terrific, and thank you for
It's
that.
well worthwhile. I mean, that benefits everybody. And right now, we need things that everybody benefits from.
We do,
We
absolutely.
really
So this
do.
is why Mike said, get Tammy on there.
Well, it's a great cause. It's just been a void since I've been here, anyhow. I think it'd benefit not only promoting the community, right? Because Chillicothe, for example, uses their trolley system for community events. They'll truck people around on St. Patty's Day for places to eat, kind of thing, and that's just one of many. But also for the employers here who have a similar problem as Bellisio
Great
has had over
thing.
the years.
I hope it succeeds. Really
Yeah.
great.
Thank
Well,
you.
you know, that, I keep saying at every one of these sessions, I say, that fellow statue up there on Courthouse Green, Jim Rhodes, anytime he spoke about a problem, it turned out to be, we need jobs. And that was true then, and I think it's true now. And for you two to dovetail, like you are public sector, private sector, I think that's something that we ought to be exploring and going forward with. So happy you were able to discuss that with us. There's another topic that Mike Evans spoke about when he's talking about impediments to employment, and you spoke about childcare.
So, food plants, and this is one that's close to my heart because we were really trying to make a go of it at Bellisio's in conjunction with the center, or the Y at that time. But the food plants operate 24/7, basically, right? And unlike many industries that work one shift, and food plants are most efficient and effective and cost effective when they're running 3 shifts. So the daycare in this, and there's an untapped workforce out there of people that have needs for childcare. They would work if they had needs for childcare. Usually on day shift, from our experience, when we've done the surveys, day shift people pretty much have it figured out. Grandma, grandpa watches the kid, or the child, or aunt, uncle, whatever. But second and third shift, it's a lot more difficult. It's tough for the parent or the grandchild to accommodate those hours. And so if we had more daycare, because I clearly believe, and our survey showed, there is a shortage of daycare on all 3 shifts, but predominantly on second and third for growth in it'd be a great infrastructure lift for this community if they had daycare on second and third shifts. And typically a second shift is a 2 to 10 or a 3 to midnight kind of thing, and third, of course, is a 10 to 6 or a midnight to 8 o'clock kind of deal. So, but all shifts from the research we have done, and it had been a few years since I've been involved in it, but the research we did several years ago showed there was a need on all 3 shifts.
And that
At least
would
in
be
our
more
place.
employment too, right?
It would be
yeah.
more employment. It would, I think it would level the playing field with some of our competing towns for employment. So if somebody works in Chillicothe and they have a child care need, it's probably much easier to get child care there on a second or third shift than it is here, for instance. Again, it'd make us more competitive as employers as well.
In the 1990s, prior to all the off-site contamination at the A plant, one of the very first training fields for child care at a vocational school was at the Vern Rife Center, which is right outside Perimeter Road. And the plant actually paid so that they had an instructor and students work second shift. And we used to it was great. They could drop off for daycare there for second shift. They didn't do first shift. And it worked out well, and then they decided they weren't gonna drop the little kids off contamination. That's a whole nother story. But partnering with an educational system like Buckeye Hills, if they had a space to do it, might be something to look into. It was wildly successful because the younger people, the students at the vocational school, were great with the children. They were great.
Yeah.
And it was really successful. And then the employees out there, it was just a payroll deduction to pay for the stipend to keep it going, and it went really well till the EPA shut it down.
Very similar model that we put together at Bellisio's, and that was our aspiration at the time. But again, pandemic kind of watered things down and spread it out, and the investment dollars went elsewhere. But I think it's still a very real possibility that if not Bellisio as an employer here, could make it a fiscally a fiscally positive thing for their business, not only from an attrition standpoint, but an attraction standpoint and employer.
Tammy, why don't you kick in from the public services standpoint?
Well, what I will say is that public-private sector partnerships, back to even what we were talking about transit, are important to all of these things to make it successful, because we as a social service agency have always known those non-traditional hours are the most difficult. And unfortunately, here in Jackson County, we only have 2 centers and 1 actual home that still exists for childcare. We've heard feedback from a lot of folks saying the guidelines and the restrictions that are tied to becoming a licensed, home. So I think that's where our public-private partnership comes into, how can we help get that interest and get folks there, and think about whether or not if it's at an employer's side, or if that's, us working with maybe the families of those folks to see if they have somebody interested in becoming a licensed child care provider, and thinking outside of the box, not just putting up a brochure or putting up a flyer, more recruitment. And we have been trying to do that. And again, unfortunately, COVID did impact that, a lot.
I'm just looking at some of the requirements you'd have to have for a child care center. You have to have building, you have to have equipment, you'd have to have trained caregivers, and you'd have to have administrative staff to run it.
A
Those
planned
all
curriculum.
seem some pretty reasonable, and your organization does that routinely. I think you're in the kid business.
We are in the
many
kid
respects.
business.
We just went through that.
And a portion of course, the centers, we work through and by our partners at the Ohio Department of Job and Family Services and the Department of Children and Youth, to help those individuals become whatever level of child care facility they want to be in. And a lot of folks used to look at it and like, you know what, I already have a couple grandkids to take care of. Why don't I just take care of a few more kids here and help out in the community? And what a significant difference that can make for their income and for the other family members that they're helping.
And you guys are equipped to make sure that they're properly qualified.
Absolutely.
That's what you do for a living.
We will screen through that list with folks, and we'll help walk them through step by step what it is they need.
You indicated that there was a lot of impetus, push in the transportation area for what we're talking about, public transport. Is there a similar impetus or push for child care? Here's what I'm thinking. Mike Evans comes and over our conversations from time to time, before and after board meetings, and he says, we need transportation around here, and we need childcare. If we had those things, we could get more people, more jobs. And that's, I'm thinking Jim Rhodes and me, we like that. Yes, what you're talking about on the transportation side sounds really good. I think there's less apparent effort on the child care side, at least from the public perspective.
I think what we see is a lot less interest in those people becoming a permanent, long-time solution for child care, and making that commitment to go through and having someone in your home, whether or not you want to make an investment to put a fence around your pool. But at the end of the day, you think about the outcomes. And we have in other communities where child care centers or individuals rather that run homes will work together, and one will provide the traditional hours, and then maybe a relative or somebody that's their neighbor can help provide those non-traditional hours, and it makes it a lot simpler when the kids can go down the street.
Who's a good model? I mean, of counties around us, are they doing anything like that?
We have a child care desert here in southeastern Ohio.
Yeah.
A lot of counties similar to Jackson, especially during COVID, saw the majority of their child care providers leave. And the governor and the Department of Children and Youth have done a lot here in the last year to start changing the step up to quality requirements for child care. It's now much simpler for individuals to get that licensing. And so one of the things we need folks to help us do is market that. It's not the stringent guidelines that perhaps you were familiar with 7 or 8 years ago. It's something that we can sit down and talk to folks about, get their interest, and help get folks there.
Well,
so
it
they
seems
can
like, especially for us in Appalachian Ohio, that these things are a key for economic development in an area that is an impoverished area anyways. And it just seems so important that it needs to be pushed.
Absolutely. When a plant looks at a town, what kinds of things do they look at? They look at the education system, they look at the library, and I think they would look at the transportation system. They would look at the child care opportunities. all these things go into the economic development package. Back when I was with the city with Mayor Evans and Ron Speakman, different parties worked together just like that, and it was all about economic development, morning, noon, and night. That was the way to make our community go forward, and you guys are talking the same language. That's what I like to hear. Okay, we've got a few minutes left. I'd like to take a look at the elephant in the room, and that would be the drug problem in Jackson County. Mike, how does the drug problem impact your plant, impact the Bellisio?
So we're not, I don't think, any different than any other, we're not indifferent to any other plant, right, or facility in the area. It is an issue. It's a predominant issue in this county that you know, a plant operationally has to take protections against for the welfare of the employees and the company itself. So we have on the application pool, there's a certain percentage of folks that are, we drug screen, right, that are
Yeah, I was going to
not
ask you,
able
what's
to.
your policy? Do you drug screen every employee that applies?
Every employee that's hired.
Every
Okay,
employee
goes
that's
through the
hired.
interview, you apply, you interview, if you're hired, there's a drug screen that's involved. So, and there's a large, proportionally, I think there's a large percentage that are screened out at that point.
Do you have the number on that, Mike?
I don't know what it,
Would you say large would be over half?
no, it wouldn't be half. It wouldn't be
Less than half.
Yeah, it's probably less than half.
And
like
does
20% maybe 20-30%.
20-30%? Does marijuana disqualify the employee?
No, not anymore.
So weed's okay, but the other stuff is not.
Well, it's not okay. Okay, it falls under the same criteria as alcohol, right? If you
Yeah.
have just cause within the facility, somebody's under the influence, and they'll be terminated, right? So it falls under the same policy as our alcohol policy or alcohol abuse policy in the facility. So it took us a few years to figure that out because that wasn't as smooth, I think, as the prohibition to legalizing alcohol transition. But but I think we have it figured out. But there's a Bellisio CP. They're a second chance employer. Okay, they've partnered with Tammy's group on several things, and we have a staff member on the ARC committee that John Kerry's part of, and they rehabilitate and rehire folks that have had a problem. And it was interesting when you were talking about the cuts that have been the current administration levied in January. So we had we partnered with Scioto County, and we had 12 employees that were second chance employees on second shift, which is a very hard shift to hire for, right? On one production line, and in a matter of 3 days they were gone because the funding was gone. So they rode together, they worked the same hours together, they went home together, and they were a really stable source of employment. But they're no longer here. It's in Scioto County, so they can't afford or to make the trip, right, individually, and they probably will. You know, the odds are they'll end up. Nothing good will come out of that. Let me put it that way for those folks.
Yes,
Right?
that's right. Okay, Tammy, do you have anything to kick in here?
I think to say, you know, of course, substance use disorder has affected probably every area of our business. You know, we've seen a number of people lose their children, and then that's, of course, coming already after the fact that they probably lost employment, unable to pay their child support, and then are also coming in to seek benefits, whether it be Medicaid, SNAP, or TANF, because they are struggling to go through recovery. And one of the things that's affected child welfare the most is the amount of time it takes someone to, you know, become sober and maintain sobriety is beyond the time frame for what we typically see for child welfare. So I'm going back to the fact that I said we have a record number of kids that have came into the permanent custody of the agency that hopefully will find a forever home through adoption one day. But it's quite, you know, the convex of what we used to see of kids coming into care possibly for a very short period of time and then working with a family that might have been struggling with something. And I don't want to take away from the importance of somebody that might have been struggling with alcoholism or a dirty home. But those are a lot of things that we had a lot more intensive resources for in the past versus someone that's struggling with recovery.
I've always had the notion that recovery from a drug problem is very difficult, and it doesn't happen all that frequently.
Right.
The drug court, for example, and
Lisa, yeah.
Lisa, let us know if we're getting it wrong, has a relatively low percentage of success, and he's got a jail to use as a hammer. So it's a tough business. It's a really tough business.
It is tough. And we do have our Ohio Start program. We see families that are a lot more intensely served, where you have both a peer mentor, someone who's has lived experience but has been in sobriety more than 3 years, as well as a case manager coming into your home every single week. Unfortunately, the state of Ohio doesn't have the funding available to support that case model, because it is what people truly need, is that hand holding and that encouragement and that lift up to help them, obtain sobriety and continue that life.
I think that one of the keys to success has to be, and this is kind of detrimental too, they have to kind of leave behind their old life.
Yes.
They cannot be with the people they associated with.
Right.
And sometimes that means leaving the area.
We have
So again, we start losing people that
It was on our
could
Judge
be
Music.
working.
We
Yeah.
used to take care. If there were some folks that had a chance but were just having the wrong crowd, you'll put them in Florida for treatment, and they'll stay down there.
Yeah. That's,
And many of them do well.
is that
Just
what you
because of the change.
had to do?
Quite a few of them, once they've gone through the system, we call them the three-peaters. We'd send them to Florida, and they have a pay it forward program with St. Matthews, which is wildly successful. So if you're a craftsman, you get through their program, they get you a job, and then you teach others. They have doctors, they've got lawyers. We have a gentleman we sent down there, an attorney, started working with him, who had been through the program to help him get his child visitation back here in Ohio taken care of. And it's wonderfully successful. And what we started doing 2 years ago, that's how I know Mr. Evans and Ms. Osborne, is that when you came into treatment court, you had to have your GED, number one thing. If you didn't have your GED or something, that's the first thing we worked on. Gave you something to do, idle mind. So we gave you something to do. Once that was done, we affiliated with some trade schools, either at our VOTEC schools or with the actual union halls to get them trained. We worked with area employers, with Bellisio, Speyside, to get them jobs, and they would know you have a job there, but you need to tell them that on Mondays at these hours you have to report to court and work from there. And once we started getting more structure that way, we actually have about a 65-35 rate of people staying sober, because they have that safety net. They've got structure, they've got new people around them that are working. A lot of them are multi-generational, as you had said. So, with their children, you can't give them to grandma and grandpa because they're addicts too. So it's getting away from that to where we found treatment places that we send women where they can take their children with them now instead of being separated there. So it's a complicated cog, but a lot of it goes back to getting their education, getting a good job, getting some pride in themselves that they have a job, they're working with those employers. And we have found a lot of people that we have placed locally, when they've worked with the treatment court and worked with the employer, have been long-term, correct me if I'm wrong, but you end up with really good long-term employees because they feel good about themselves finally. They have accomplished something, and that's part of their self-worth, is who I work for and my employer cares.
Okay, viewers, what we're trying to say here is that if more resources were devoted to some of these ideas, we have good reason to believe that you could get good results out of it. And it kind of circles around jobs again, I think is what we've been saying today. So folks, thank you very much for the discussion. Do you have any concluding remarks, first of all, Tammy?
I think that we encourage folks, when they have a question about what it is we do, to give us a call, because that's how we get our word out there. And if you want to know more, call me. I'll be the one that go out. But one of the things we need to do is that our community is who we serve. and we want to make sure that we're doing everything we can, and we try that.
Mike?
Yeah, no, just echo that. If, as a former employee for an employer here, I think it's important to, if you're having those kind of struggles, not only in those three categories, but anything in a facility, see your HR person, and then they'll generally, especially if it hits those three topics, will partner with somebody like Tammy's organization to make sure it works for you. It takes a lot of effort. We have a really good HR team at Bellisio anyhow, with Michelle Skaggs over there. And but they I know they go the extra mile to give every employee the opportunity to be successful, and I don't think we're any different than any of the other employees here.
Dennis?
I just learned three things that could be done to help an area that really needs help, southeastern Ohio. And hopefully, you know, the people in the State House, I mean, they could understand that, or we could push that, you know, because, you know, we've been ignored for so long, and there hasn't been a way to improve this area. You know, we're kind of the forgotten people, and there are answers. Listening to you, listen to Lisa, there are answers to it. They just need to be applied.
Okay, with that, I think we'll close it down.